All right. Now I would like to welcome you all to our today's webinar, Strengthening Survivor-Led Peer Support in Domestic Violence Programs. My name is Tori Weinkoop. You'll also see Victoria on the screen. I use she, her pronouns, and I am a citizen of the Spokane Tribe and the Training and Technical Assistance Manager with the National Center on Domestic Violence, Trauma, and Mental Health. Kathy, would you like to introduce yourself?
Sure. Welcome, everyone. Thanks for joining. My name is Kathy Cave. I also work at the National Center on Domestic Violence, Trauma, and Mental Health. I am the Senior Training Consultant and have been with the center right around 12 years now. So thanks for joining us. And Tori, I turn it back to you.
So the National Center on Domestic Violence, Trauma, and Mental Health is a special issue resource center dedicated to addressing the intersections of domestic violence, trauma, substance use, and mental health. We have 4 focus areas that include training and technical assistance, research and evaluation, policy development and analysis, and public awareness. And if you turn your attention to the right-hand side here on this slide, you will see our accessible, culturally responsive, trauma-informed framework. And this is the framework that the center uses for the way we look at, think about, and develop our work. And so the outside circle holds what we know about domestic and sexual violence and the lens we bring to our work, which includes human rights and social justice, cultural, historical, and community context, domestic and sexual violence advocacy, and a trauma-informed approach. And the inner circle has a focus on relationship and connection. And without relationship and connection, we can have great ideas, but without holding respect and collaboration in the ways we connect with survivors, we are likely to do harm. So with that in mind, the inside circle represents our core principles here at the center, which are a survivor-defined approach, physical and emotional safety, hope and resilience, and relationship and connection. I want us to take a moment now for us to be fully present within ourselves and within today's webinar. I want us to take this moment to take a couple of deep breaths, get settled into our seats, wiggle the tips of our fingers, the tips of our toes, and just use that breath to remember a time when you felt scared, lonely, or overwhelmed. When you felt scared or lonely, what was helpful and who was helpful? And you don't have to share these responses out loud. You can keep that within yourself as well. And so thinking within this moment, what I want us to get from this breathing exercise, this mindfulness moment, is to reflect on our access to trusted others. Because for many of us, when we felt that sense of scare or fear, what has helped us is our access to trust and someone who may have listened, someone who may have cared, and someone who shared their own experiences and inspired hope. And so today, we will explore these priorities of access to trusted others and inspiring hope by bringing and looking at survivor-led peer support within our programs. And so this means supporting survivors to support each other and activities and conversations that don't include advocates or other staff. This means that activities are led by survivors for survivors. In the last webinar, we reviewed accessible environments here, and we want to strengthen our knowledge on accessible environments for healing, especially at the relational environment, because a core part of peer support is relationship building between survivors. And so, what is peer support among survivors? Peer support is a process of survivors giving and receiving help in relationship with each other, not just with staff, because they share experiences of violence, mental health challenges, and trauma. And support is really based off the values of respect, mutuality, compassion, connection, empathy without judgment. And other values that we can include within this is transparency, trustworthiness, and really sharing the hard truths. And when we look at peer support and the values that come with it, you could easily be asking yourselves, what does it look like to implement peer support? What is that? How can you lay that out, right? For advocates and for us that are trying to support survivors. And realistically, the how to comes directly from the values and staying aligned with them, which is different from a formula to help with scenarios. So just keeping in mind that it's a values-based approach where we're allowing survivors to, where we where survivors are allowing us to continue on the journey with them for healing and support. So with values as one of the foundational elements of peer support, the core part of it is the shared experiences among survivors sharing with each other. So survivors sharing their experiences. And with that, some of the big worries for some folks in programs is that if we talk about our pain and if we talk about those shared experiences, that will activate others' trauma and there could be chaos. And I just want to say that that's not always true. So, for instance, in the mental health system, there was peer support where movement of people who were harmed in the psychiatric system. And today, research support that it is an effective way of healing. So we're trying to dispel the myth that if survivors are talking amongst themselves, that it's bad or it's scary. But in reality, it's something that we've always done to begin with. Kathy, would you like to share a couple of examples of this?
Sure, thank you. I think that what is important for us to hold is that survivors have always been talking amongst themselves and to each other and with each other. And so when Tori mentioned the history of peer support in the mental health system was folks who were gathering in parks and in quiet places, in coffee houses, anywhere that folks could gather and feel safe to talk, sometimes within hospital settings, and would support each other, share what their struggles were, shared what was helpful, shared how to navigate the systems. And what we know is that for those of us who have had experiences with trauma and violence, having someone who understands that without judgment has been incredibly helpful. So as we spend time together in this conversation today, I'll share some examples from a domestic violence program that has spent the last year and a half to 2 years creating survivor-led peer support as part of what they regularly offer within their program. So thanks, Tori. I'll come back to some pieces as we go.
So, yeah, that was a great example in really breaking out the mental health system with peer support. Another aspect to think about is that while values is a foundational part of peer support is also a foundation of the domestic and sexual violence movement and advocacy. And so incorporating peer support can add options for survivors to support each other And it doesn't take away from the important work of advocates. And it also does not take away the work that survivors are doing for themselves. So, as mentioned before, peer support in mental health and substance use services and treatment settings has been very active over many decades. And in the early days of the movements to end domestic and sexual violence, it's filled with a lot of stories that come from peer support relationship building. And people who understood the experiences frequently supported other survivors to safety. And people held groups where they shared about what happened to them, and others listened, learned, and strengthened our advocacy and has influenced of what it is today. So, what makes peer support unique? Reciprocity. That's what makes it unique because it is the practice of exchanging things with others for mutual benefit. And in this case, it's our stories. We're sharing our stories that help with healing and inspirations and really providing that support for one another to ensure that we have numerous amounts of resources. And thinking about resources with peer support as advocates, we can think of peer support as another means of providing resources to survivors. And so, thinking about peer support as a resource, we can ask ourselves why? Why this practice? And so, being offered as a resource, people hold a wide range of perspectives about their experiences with violence and the impacts of those experiences. And so, survivors may be fearful that talking about mental health and other challenges with maybe staff members or other service providers can prevent them from accessing services. So, they're working with other survivors and other peers to discuss these experiences or these shared stories. And people have different ways of talking about and making meaning of what has happened to them. And so the practice of peer support prioritizes emotional safety and choice, which can be a really new experience for some survivors, especially when power and control dynamics are present within intimate partner violence. But also, it can be a new experience within our organizations too, if it feels like there's many barriers to accessing the services that we're giving. And with peer support, there is minimizing harm to each other and just thinking about that. If harm does happen, it's important that we name it and we work together to get through it. And so, who offers peer support? Peer support is a survivor centered practice, and those who participate can help set the rules together. And so, with that, survivors can decide on group agreements, activities, what would help them, and how they would like to receive support from the program that they're accessing services from. And so, I'd like to turn this back over to Kathy so she can share her own experiences with this.
Yeah, thank you, Tori. I guess where I would start is, years ago I was co-presenting a workshop on peer support and being trauma informed in peer support practice with Darby Penny, who's a longtime advocate around peer support. And I remember it was a big conference. We had a workshop. There were probably, 30 people in the room. And as we were talking, there was a person who put their hand up and said, so wait. Do you mean that survivors are talking amongst themselves and that staff are not present? And so I was curious as to, why that response and how it came up. And the speaker spoke up and she said, I'm a director in a domestic violence program, and what we have experienced when survivors are talking, with each other, is that they're activating each other's trauma, or they are sharing things and some gory details about the things that have happened, or that they do what, in my mind and how we talk about it a lot is the oppression Olympics of, if that happened to you, let me tell you what happened to me. And as we were listening to her, what we were thinking and talking about in responding to this concern is that the more we talk and the more we prepare folks and we talk about, what does it mean to be trauma informed for everybody? What does it mean to be trauma responsive? Is it possible to have peer support, live and breathe and thrive in domestic violence programs? And so, come full circle and several years later, there is a domestic violence program that we have been working with at the National Center where they have decided to prioritize peer support in their program. So I want to share a little bit about that because the process has been amazing to witness. And when I hear the survivors talking with each other, just about how powerful it is for each and every one of them, I'm convinced we're on the right track with this. So in their program, they started asking and thinking about peer support within a domestic violence program about 2 years ago. And there was a lot of curiosity and a lot of concern and a lot of worry. And so we had lots of conversations. And what the program decided to do was to talk with all of the staff, so all the advocates. The program also has a clinical team. They talked about, they talked with survivors about who might be interested in doing something like this. They talked about, from a leadership perspective, what does it mean for us to engage in this process of really strengthening peer support within the domestic violence program. So as part of their process was that they reached out for some help from folks who were experienced with this idea of peer support. So peer support can happen in many ways, and one of those ways is to partner with a peer support program in your community. So folks have done that, they've talked about that. And when this particular program looked into it, what they decided is that it would feel more safe if they had those resources within their program. Their next step was to actually create an advisory. So I'm not sharing the name of the program for safety reasons, but that, just to be clear that this didn't happen overnight, that there was a process of all of the staff learning more about what peer support would look like. And there was a process for survivors to be engaged right from the beginning. And the question was, what do we want this to look like here? What do you want it to look like? So there were probably, I think, 10 or 11 survivors who were already connected with the program. They became an advisory committee and they kept these conversations going for somewhere between 10 and 12 months about what do we want peer support to look like. So in the meantime, the survivors who were part of the advisory were getting much more comfortable and clear about talking with each other. So there was peer support happening while they were learning about peer support and how to strengthen it, how to make it what they chose and what they wanted it to be. And so I'll talk a little bit more as we go, but those are the foundational pieces in the beginning because it was new for all of them and really trying to decide, where do we start? How can we start? Next slide, please.
So before we go to the next slide, Kathy, I just want to very quickly share what was written in the chat.
Oh, sure.
And someone shared that currently our program does not offer survivor-led groups officially, but I am a survivor of DV, SA, and child abuse, and very open with my survivors in my DV support group I hold. This is something that I have catered to, this concept of peer support, and I have had amazing success thus far. And they are currently a DV advocate.
Wonderful. And what you're saying, and thank you so much for sharing that, is at the heart of peer support. There are those of us who have various experiences There are things that we have survived and feel strongly about and are open to authentically sharing those experiences. So one of the core values in peer support is that authenticity. So Tori talked a little bit about reciprocity. That authenticity is everything. So we can say that out loud and without shame, without worry that we're sharing too much. And so the process of peer support is, I mean, I don't honestly, I struggle for words because it was life changing for me. And the ways that we can think together and talk together and work together to support one another in these very open ways without this top down experience. So when we talk about, as advocates, how do we support peer support? How do we talk about it with survivors? It's definitely rooted in those values, as Tori was saying. So when we can name them, when we can talk about how important that is, when we can be clear that yes, there have been challenges, especially if it's something that's happening within your program, you can talk about it as yes, that there was a challenge there. We can name that, and we can also seek to repair it and to talk about when we know better, when we know more, when we understand trauma and the impacts of trauma, given the experiences that we've had, there are ways that we can share. There are ways that we can be gentle with ourselves and with each other and work together so that peer support is valued and is strong and is helpful, and that we're assisting one another as equals. So much of the experience when violence is part of your life is based in responding and surviving within these dynamics around power and control. So peer support can be a natural antidote to those things. One of the challenges that came up as we were talking with the program director in our workshop was really around, if people share too much, what if there's too many details? I mean, I have had the experience of someone sharing so many details from a violent experience that they had that I could close my eyes and I could see it. So one of the things that we talked about with the group that was, intentionally bringing peer support in is how do we not do that? What are the ways that we can share where there's a piece, there's a detail, where something is authentic, but we're also not sharing everything. And that there are ways to think about what do I share that would be helpful right now. And so these are the kinds of things that this particular group really worked on and really talked about. And then they asked for some training, and I'll share some of the pieces of that training as we go forward. The important thing is to really understand that there are differences in not only what we experience, but in the meaning that we make of them. The first time I ever went to a peer support group, I think I sat in a room and just cried. And what I realized after a few weeks of that was that, oh, wait, I'm welcome here, even though I'm crying. That there's not this judgment of, or you must participate kind of directive or dynamic in things. It's just come as you are. We'll be here with you as you are, and we'll work it out. We'll walk side by side together. And so these are the kinds of things that can thrive when we're intentional. And again, really appreciating what the person shared in the chat, because that's exactly the core of it. It's I can share pieces of myself and not be judged. I can share pieces of myself that may be inspirational to somebody else. I can share pieces of myself that will continue to be looked at, and that I can continue to look at and examine, that in the telling, in the sharing, I'm actually organizing, on some levels, what happened to me. So these are the things that we can do when we're in peer support with one another, and that advocates can talk with survivors about that. These are the values of peer support. These are the kinds of things that are helpful to do and to share and to think. But advocates can also be curious with survivors about the kinds of things that might be helpful for them to hear or to experience in the practice of peer support. So there's a lot of room for curiosity. Go ahead, next slide, please. Sometimes when I'm engaged in peer support, before folks know me, they'll start to tell me absolutely everything. And, I'm very quick to say, anything you're wanting to share, I'm here for it. I'm here for it. You can tell me, you can share that. But I also would say, when you trust me, then you have more choice. Your decisions have more power because you're choosing what to share with me rather than feeling like you have to share everything. So that's a really good conversation that advocates can have with survivors in your programs around, when you're in a support group, what are the types of things that you might want to hear? What might be helpful to share? What feels possible to do? What feels like it might be too much? And, and also to encourage that you may feel about these things this way today, but on another day, you may have a different thought about that. And so if you're participating, you'd like to participate, you'd like to talk, wherever you are today does not have to be, the only decision you get to make or the only opportunity you have to choose what would be good. So I guess there's another value to add to that list around flexibility, that there is no set role about what you must do in peer support or what you must get out of peer support. We develop it together as we go. I think something that challenges us around peer support is that when we worry about talking about trauma, at our center, we've been talking for, decades about how do we show up and talk about trauma. And what I would offer is that there are ways that we can share our experience. There are ways that we can also to talk with survivors about, yeah, trauma does that. So there are things that we know in terms of the ways that trauma impacts our mind, body, and spirit. For advocates to be able to talk with survivors about, yeah, trauma does that. You might feel unsettled and uncomfortable. Trauma does that. You may feel scared or exhausted or just that everything is one thing too much is how I think about it in my head, that whatever the next thing is, it's just too big, it's too much. Trauma can leave us feeling that in that way. So to be able to say trauma does that helps to support survivors to not blame themselves for how they're feeling. It helps all of us to hold that mental health challenges make sense. So one of the other pieces here to hold is that sometimes talking about the things that trauma does, the way it leaves us feeling, can be really incredibly helpful to share that. That sometimes it's not the talking about everything, but it is the talking about what's coming up for me today in this moment that can be incredibly helpful. So for advocates working directly with survivors to encourage learning about trauma, learning the impact of trauma on us as individuals. So I know I may be feeling differently than even my siblings who are also trauma survivors. I may be feeling differently than my best friends who are trauma survivors. I may be feeling differently today than I felt yesterday, and that trauma does exactly that. So giving people that information is powerful, and it's also, those are tools and resources that they can bring into peer support to share. So there's no static role of who's the person being helped and who's the person offering help. We're equals. We all have skills, talents, information, and we can share that. And sometimes we can also choose to be present and listen and cry. So having been in those spaces, there's been benefit to all of that. I think the best way to support the development of peer support is for everyone in the program, so leadership, advocates, and survivors, to be clear about the intention. And sometimes we get in spaces where, oh, we said it, we decided, we had a group agreement, and we decided on these things. So everybody's going to we'll all be perfect. We will all be able to stay within the boundaries we've set. And so what the other thing we know is trauma doesn't work that way. When trauma is impacting us, whether it's from our historical trauma or current trauma, we respond to that. And that typical response is our fight, flight, and freeze. And then there's all the ways that we have socially learned to respond. So to not be afraid of talking about those things is really a hallmark of peer support. We can talk about those hard conversations. Next slide, please.
I just want to quickly share something that really resonated with what you said, Kathy, where you
Sure.
commented on um, you've had experiences where survivors just come and tell you everything about their experiences without really knowing you, and how that's a sign that they trust you, and through that trust they get to determine and really hone in how they share their stories and really connect within themselves. And I think that's really beautiful, because oftentimes when survivors are accessing services or these other resources, um, it can feel very, like, very invasive, because there's this need to know the whole story in order to understand or to put on that concept of deserving versus non-deserving. And so really highlighting that when the survivor trusts someone, it is truly their autonomy and, like, their choices of how they share their story and their own message of inspiration to others. And I think that's really great to keep in mind and to remember as we consider peer support practices.
Yeah, thank you. As we think together about, how powerful peer support can be, there's also this piece around, so what do we do? So we're together, we're here, what do we do? And sometimes in peer support, people will have very formal groups, and the same as any other group that might be occurring in your programs, except that survivors are leading it. It's them. Sometimes folks have asked for an advocate or asked for staff to be nearby, sometimes in the room, but to not interfere, just in case somebody in the room wants to ask an advocate for help. And so while survivors are still leading, that advocate is, really taking a back seat. Or if survivors are meeting in a room, the advocate might be right outside the door. So there are ways to think about and be creative about, what will we do in survivor peer support? What will that look like for us? So yes, there can be lots of talking about individual experiences. It can be in a group setting or one-to-one. It can be virtual or in person. So the program that I was sharing a little bit about, they had an initial 2-day meeting because they requested some training about the history of peer support and what the values are and how to get grounded. How do you set ground rules? How do you create and then add to group agreements? What to do if someone gets upset? So they had all these kinds of questions. And so we offered them this training and they participated and they were excited about it. And then it was time for them to decide, what is it that you all want to do next? And so part of the group had talked about, we would like to meet and go to a movie. So these folks were participating, the folks who were participating in this particular conversation were involved in non-residential services. And so they had known each other. Some of them have known each other from different group activities that the program offered or that were connected to the program. So they talked about that. Some of us would like to go to the movies. And so they talked about that for a little bit. And as the more they talked about it, what they realized is that one, everybody didn't want that. Everybody wasn't interested in going out and doing a social thing. Some thought social okay, but how about coffee? Because I don't want to be sitting in a dark theater for 2.5 hours. And so, without any directing, they talked amongst themselves and they worked it out. What they decided to do next was actually a virtual group meeting that everyone could attend, and they decided that Mondays were best. So, really being able to say, what we would like is this, and we're thinking about these options and making these decisions. Just that process supported their healing for each person because each person's voice mattered in making a decision about the activity that they would do next. Some folks talked about what are the things that we could do? Maybe there's something we could do together that we could learn something new or do something new together. And what the program offered the group is that whenever the group wanted to set some time and space to do something together, they would be willing, the program was willing to do it on site. And they had dedicated a space where the group could meet. And the program also offered that depending on the activities that they could provide supplies. So if someone wanted to learn and, let's say knitting or crocheting, that the program would provide knitting needles, crochet hooks, yarn. And same as in a previous agreement, staff from the program were nearby but did not need to be in the space unless they were invited. So it kept all the decision making with the group, and the survivors decided what they wanted to do. So their next activity, they also decided to do a group meeting and to have it virtual, but needed to look at a different day or time. They negotiated that with support from the program. And so the program support was mostly, again, these were non-residential services. So it was to offer to do a shared email contact, to share for those who were interested and wanted to share email and phone numbers in a group list, that they decided to go ahead and do that. And at any time, anyone could opt out. And so these are the kinds of things that they talked about. What they also decided that when it comes to navigating systems, that they would always check in with program staff. So there was a clinician that they've requested contact with at different times, different members. There's advocates that different times, different group members have contacted. And the program director was also very involved in the conversations to make sure that leadership, advocates, and survivors were all on the same page. Next slide, please. Again, biggest concern around all of this, as folks were getting new ideas, getting new information, really thinking about how do you choose what to share, but recognizing that in peer support, just by the nature of what we're doing, it's an invitation to be listening to each other sharing and being able to share yourself when you want to. And so recognizing that, again, as I said earlier, the sharing helps to organize experience, helps to make sense of the things that have happened, that we are participating as equals in a group where some of us are struggling with mental health challenges in the moment and some are not. Some are struggling with substance use, some are not. The shared theme is that they were all connected to this domestic violence program, and that gave that baseline, I think, in terms of experience. And then people choose to share what they wish. When folks shared, one of the things that happened immediately, and you could see it go right around the table, is sometimes folks were kind of, sitting back and listening and taking it in. And then there were times when folks would lean a little bit forward in their seats and ask, is it okay if I ask a question? And that the questions folks asked were really about, how did you stay hopeful? Or what was helpful? What was it that kept you trying and trying to connect and staying connected to the program, working with the advocates? So the curiosity, once we talked about what's helpful in the sharing, the curiosity was really about the experience and the inspiration, not so much the details of this happened to you, let me tell you what happened to me. That when we provided some information, some guidance about how to share, how to check in with each other. So, one of the check ins that we use a lot in peer support is, before we get started, is there anything we need to do for you to feel more safe and more comfortable? And just that simple statement gave everybody this permission to ask for what they need. And folks made time for that. And when they did their second group, they made time for that. So it's much less about someone telling them they had to make space for it, but the group deciding they were going to make space for it. And so they inspire each other to be hopeful. One of the other things that I think is intriguing is that very often when we're starting in peer support, there's a wish to just use talk, right? Because that's what we know. So many of us have been, involved in many different kinds of systems, and the expectation is to be there, to participate, to have access to the service. As Tori was saying earlier, you need to share a whole lot about yourself. And what folks talked about, and I've seen happen again and again and again in peer support, that people get creative about what they're doing and how they want to do it. So we have people who write poetry, that sometimes somebody will share a song that had some meaning for them, that sometimes there's more power in the sharing, that is, I drew this picture or I wanted to share this. And so just to think about ways that we can share and create together is also a big part of peer support.
I think what you're describing, Kathy, goes along with this question in the chat.
Mm.
um, it states, I work with students, so they're a population who are moving in and out of our center in a relatively short amount of time, and their schedules are constantly changing. They're really interested in peer support spaces, but can't always commit to the leadership and labor with everything going on and their short timelines. So, how do you recommend getting started when we can't do the full scale peer led program like you are describing? And then in parentheses, which sounds amazing.
Love that. Thanks so much. One thing I will say is that peer support happens in these big programmatic ways, but it also happens because you and I are having a conversation. That too is peer support. And so sometimes, particularly with folks who are either, again, short time in the space, or this would be a whole new thing, asking folks to either bring something that they created and share about that, what it means. And again, as long as you start with a group agreement, that you can then remind people what the group agreement is. So if it's our agreement to not interrupt, to really listen to the person who's speaking, to be respectful, and then talk about what that means. Whatever that group agreement is that the group creates can be for this moment, for this 2 weeks, for this week, for this day, for this hour and a half that we have, right? So it can happen in all those ways. So there's not a set role around helper and helpee, but there's also not a set role around that we have to meet forever, and that's the only way to do it. The creation of the group comes from the group. So if we have, a 2-hour block of time, what could we do with this to support each other that would feel good is a great question once you have group agreement. Okay, let's go ahead to the next slide. I want to talk briefly about choosing what to share because this is a big deal for those that share and those that listen. So, one of the things that is a great activity to do, and it can happen in one conversation, is you ask folks to create a life map. So, your life map has the day you were born and ends with today. And what are the significant events that happened along the way? So you can draw pictures, you can write words, you can use dates. Sometimes you might use one meeting to create a life map, and then you could get next time you get together, you could share. But the way that this works is that you give people a heads up that they're going to be sharing. So to think about what they want to share while they're creating, because sometimes that makes a difference for folks. But then when we actually share them, we ask people to partner up. And with your partner, I want you to ask your partner one thing that's on your mind. And we would do this right now if we had a longer time together. Think about one thing that's on your mind. And then with your partner, after you listen to what's on their mind, you look at your life map and you choose one thing to share. So your map may be, a page full of pictures and words and dates and times. And you're going to share one thing based on what's coming up for the other person, based on a similar experience or a time when you felt resilient when you were under distress, a time when you felt hopeful, something that helped you with problem solving, what inspires you. So it's a brief activity in that the sharing is intentionally brief on purpose, right? You have 10 minutes to share. So if you spend a whole lot of time and try to tell everything in this activity, then you don't both have a chance to share. And so that's a way to introduce sharing something based on what someone else is experiencing and taps into that empathy. And it was amazing and wonderful what people chose to share and what they learned about empathy and caring. And so, as an advocate, I could also have a conversation if you were going to share something about what supported you, what felt resilient, what would you share? And so, there are ways we can support survivors to participate in these kinds of conversations and be ready to think about it, to not be originally surprised, or to also just to be okay to just listen for now and maybe share it another time. Next slide, please. As important as it is to share what peer support is about, it's important to share what it is not. So there's not a focus on what's wrong with folks. So the reason you have a group agreement is because as a group, we can say, it feels like you are blaming me for something. And that's not for this group. That's not for this conversation. And, as we go, we learn to get much more comfortable to say, that conversation's not for me, or this is not okay for me. So we're not focused on what diagnosis or label did you get? What's wrong with you? Those are not the ways that we show up for peer support. It's also not about being a counselor or being in someone's role. The way I talk about it is if you find yourself telling someone what to do, you have stepped outside of the lane of peer support. So it's truly about this listening around caring about what supports survival for me, and I can share that because it may be hopeful for somebody else. It's not about giving advice. It's not about pressuring people to follow the rules or to comply. That's not the purpose. We more would be likely to say, you know what, I did break this rule and this is what it felt like. I might talk about it from that way, but not, oh my goodness, you can't break these rules. So it's really not about this monitoring. It really is about another resource to offer support where survivors are supporting each other. Next slide, please. One of the other themes that comes up when we talk about what peer support is and isn't is that we need to be prepared for people to disagree, that we have lots of different views about mental health challenges, about our experiences with violence, about what we feel recovery and healing looks like. So sometimes folks will say, I got a diagnosis and it was helpful. It explained what I wasn't understanding about why am I doing these things. It was helpful in that way. It was helpful to name that, yeah, that's what depression looks like, or yes, trauma does that. Sometimes folks will believe that recovery and healing happen with mental health care from the mental health system, which might include medication. And sometimes folks will say, no, that's not me. I'm going to do more physical activity. I am going to do these healing practices that are part of my culture and that feel good to me. And sometimes folks will say, I was clueless. I didn't know anything until I learned more about trauma. And now that I'm aware, I have different ways of coping, and that works. So we need to, in our work as advocates, understand that there are these different views and that we can talk with survivors about that, but we can also encourage folks to listen for other people's perspectives and try to understand what they're saying. And so it might not be for us, it might not be what we agree to, but it is someone else's experience, and that's okay for them. Next slide, please. One of the challenges is a human challenge. It's not only a challenge for survivors who are engaged in our advocacy and our support, it's for all humans. That in our interactions with one another, we need to be aware of our own trauma impacts for as much as we're able. So I know that there's a certain set of scents that I can't do. And when I do them, they automatically, activate my fear system. And it's like, oh my goodness, I'm now having a trauma response. In the past, I didn't know what those smells were, but now I do. So now I can do things that cope with them to help me cope with them. So it's thinking about how do we always keep reaching for improved self-awareness to continue to grow in these ways. Next slide. So it's knowing what it is that activates your system and to really practice self-care. I appreciate Tori starting us out today with a mindfulness moment because we do need to be aware of what are our own needs. What are the ways that we're impacted by trauma, by the work, by the ways that we show up in support of one another? Again, as human beings, we deserve to take care of ourselves. We absolutely need to bring our best selves to doing this work because trauma is such an integral part of the work that we do. Next slide, please. So for all of us to think about what supports healing, and so these are some of the pieces, and you all may have some other ideas and you want to put them in the chat really quickly as we start to wrap up today. That would be great. But we need to have control over our lives and our environments as much as possible. That not just physical safety, but emotional safety is important. That because trauma can be so unpredictable and the things that have happened have been so unpredictable, that to build in as much predictability and control around all the things in our lives as we can. And so as we think together about integrating peer support, how do we think about some small things we can do? It's how do we establish some cultural connection, have space for belonging? Peer support can do any of those things and can support any of those things. Next slide. And then again, as we're wrapping up, The key theme, I think, that I can't say enough about is for us to be clear about how peer support will be included and supported as it grows and develops, and to consider that if there are challenges, those are things to embrace and to talk about. Those are not reasons to shut it down. So let's talk together about this happened, what can we do about it, and evolving leadership, all staff, and the survivors who are engaged in the process to do some problem solving together. So let's go ahead to the end. And there's some resources there. And Tori, I'll turn this back to you.
Yeah, thank you so much, Kathy. So for the additional resources, here is our website's URL, so ncdvtmh.org. And you can also follow us on our social medias. For Instagram, it's at ncdvtmh, and for Facebook, I believe it's National Center on Domestic Violence, Trauma, and Mental Health. Some specific resources that we wanted to share with you today are the Tools for Transformation Toolkit, Becoming Accessible, Culturally Responsive, and Trauma-Informed Organizations. And this comes with two guides. Guide 1 is the Social, Emotional, and Relational Climate and Organizational Trauma. And Guide 2 is Supporting Leadership Change. And this next resource is it's a guide for emotional support where on page 4 you can go and answer some of the questions or use this as, the initial meeting with the survivor and ask these questions to help provide emotional support, emotional safety. And this guide is also available in English, Spanish, French, and Korean, and we are working to get it translated into Arabic, Urdu, Hindi, Chinese, and Tagalog. So thank you all, and this has been a great session. Many thanks to our interpreters and the NCDV TMH team. And we just want to thank everyone that joined us today. Please click on the survey link that's provided in the chat and let us know what worked and how we did today. Within the next week or so, we will send you all a follow-up email with a link to the recording of today's webinar in addition to the slides and any handouts mentioned, all of which will also be available on our website. You will also receive certificates of attendance for your time today and a link to the evaluation for the webinar. Thanks again, and we hope you all have a lovely afternoon.
Thanks, everyone.